Hello dear friends, hello dear viewers, welcome to my YouTube channel Naeem Videos. I hope you all viewers will be fine and doing well. In the previous lecture videos I had discussed the isolation, infection, chain of infection, transmission based precautions. I had discussed the contact precautions, droplet precautions and airborne precautions. But now in this video here I will discuss the airborne contact precautions and their recommendations of airborne precaution, plus I will discuss negative pressure and enteric precautions. I hope you will like my video. If you are new on my YouTube channel Naeem Videos and have not yet subscribed to my YouTube channel, then here I kindly request you to please do subscribe my YouTube channel Naeem Videos and press the bell icon to receive the notification of my upcoming videos. So dear friends, here we are with the airborne contact precautions. So airborne contact precautions are used to prevent transmission of varicella, chickenpox, disseminated herpes zoster or localized zoster in an immune compromised patient. Recommendation of airborne contact precautions, basically the recommendations are negative pressure single room as required for the patient, plus the door to the room must remain closed at all times. Person not immune to varicella should not enter the room. At least caregiver should assign to the patient. Recommendations for airborne or droplet contact precautions include: a susceptible person must enter the room of a patient with varicella. An isolation mask should be worn, but this may not be completely protective. Put on a gown and gloves before entering the patient room. As part of standard precautions, a mask and eye protection are required for close contact within 3 feet with a cupping patient. Remove gown and gloves just inside the door to the patient room and discard within the room. Wash hands thoroughly after gown and gloves removal. In the airborne precautions are used to prevent the spread of TB, Mycobacterium tuberculosis, measles, severe acute respiratory syndrome, SARS, herpes zoster like shingles, and varicella, which is chickenpox. Airborne transmission also occurs by dissemination of airborne droplets, nuclei, tiny particles containing microorganisms that remain suspended in the air for long periods. These microorganisms are generated from the infected person, generally by coughing, sneezing, and talking, or by procedures which generate secretions, suctioning, bronchoscopy, and may be inhaled by a susceptible host. Negative pressure single room as required. The door to the room must remain closed at all times. Wash hands thoroughly or use alcohol hand gel before entering and after exiting the room. Use a powered air purifying respirator PAPR or N95 respirator when in the room. Visitor will be restricted to parents on or to designated primary caregivers. Parents' primary caregivers will be screened for evidence of pulmonary tuberculosis and will be isolated to the room with the patient until the evaluation is completed. Patient may not leave the isolation room except for essential tests or procedures that cannot be performed in the room. If possible, the patient wear an isolation mask when out of the room. Standard precautions: airborne plus contact isolation prior to entering the room. Visitors see nurse before entering, clean their hands, wear their gowns, wear their N95 or PAPR mask and gloves. Enteric precautions designed to prevent infection that are transmitted by direct or indirect contact with fecal material such as salmonella, gastroenteritis, used to control diseases that can be transmitted through direct or and direct oral contact with infected feces or contaminated articles, for example, hepatitis A and dysentery. Place patient in a single private room, put on a gown and gloves before entering the patient room, remove gown and gloves just inside the door to the patient's room and discard within the room. Wash hands thoroughly after gloves and gown removed. Gowns should only be worn when handling object contaminated with feces. Infection which require enteric precautions, a diarrhea infection or of unknown origin like diarrhea infection of Clostridium difficile, norovirus, rotavirus and hepatitis A virus. Strict precautions are also followed for some infections like strict precautions are used to prevent the transmission of all highly communicable disease that are spread by both contact and airborne routes of transmission. Strict isolation designed for highly contagious infections that are spread by both airborne droplet, nuclei, and contact transmission, like chickenpox and rabies. Recommendations for strict precautions. So there are some recommendations for strict precautions like you should place patient in a single private room, put on a gown, mask and gloves before entering the patient room, remove gown and gloves just inside the door to the patient's room and discard within the room. Wash hands thoroughly, private room with negative airflow. Infection which requires strict precautions are infection, tuberculosis, cholera, varicella, disseminated herpes zoster, diphtheria, yellow fever, and severe acute respiratory syndrome. Protective precautions are also used for the prevention of the disease, but we will discuss this protective precautions, their recommendation, wound and skin precautions and blood precautions plus discharge precaution in the upcoming next videos. Thank you so much for watching my video. I hope you will like my video. If you are watching my video till end and you are here listening me, then here I kindly request you to please like my video, share my video and do subscribe my YouTube channel Naeem Videos. I will be very thankful.